through it, Rahul?
Yeah, sure. So my name's Rahul Singh, and I'm a paramedic by profession. A number of years ago, back in the late 90s, I found myself unceremoniously dumped out of my marriage. I bought a ticket around the world, and I backpacked around the world, basically chasing after Swedish women. And what I ended up doing when I ended up in Nepal was I met a gentleman who said, why don't you teach our medics the skills that you have on a rescue team? So I said, sure. I bought a brick of cheese, a 2-liter bottle of Coca-Cola, and a bottle of ketchup, and that was my entire sundry supply. And I went high up into the mountains, and I lived in a local hospital and trained medics. And in the middle of that, we were deployed. We were deployed into a disaster zone from heavy rains and mudslides that wiped out villages. And day and night, we would work and treat people and get them clean water and provide them with health care. And what ended up happening is we ended up getting shut down because the powers that be decided that we ran out of funds. There was no more money to help these folks. So I had to hike out of the mountains and come in and meet the bosses. And what I found was I was quite upset. I found them living in a 5-star hotel, and they took me out for a $22 meal of pepper steak. And this is mid-90s in Nepal, where a tourist could probably live on about $8 US. So I was really upset with the idea that the money that was coming into international aid was not necessarily getting to the folks that really needed that assistance. So I ended up coming out of that country, and my best friend passed away. I got back home to go to the funeral, and I decided I was going to create a disaster response agency that get all the funds out without administration right to the people that needed it, and hence Global Medic was born. And what we do is we do two things. We have capacity building programs, so we go into post-conflict nations and train medics to work on landmine clearance teams so that society can rebuild. So every country that's out there that you hear in the news, the Afghanistans, the Iraqs, the Sri Lankas, where there's been a war, there's folks like us that go out and train these medics so we can start with building civil society again. And then we do disaster response. So we've got 3 teams, a search and rescue unit, a water purification unit, and an emergency medical unit that goes out and deploys inflatable field hospitals, puts up water purification systems to get people in the time of disaster access to those basic services to keep them alive. To give you an example of some of the things that we've done in 2010, we were first into Haiti. 60 hours after the quake, our surgeons were up chopping off limbs because 60 hours after the quake's too late to be resetting bones. We treated 7,000 patients. Of that, 400 were surgical interventions. We put up 64 water purification units. Those units put out 1 million liters of water a week. That's 15 million liters of water we gave. Now, the best thing about what we did in Haiti was we trained local Haitians to run the systems, which means that after our teams departed and gone back to our regular jobs, where we are paramedics, police officers, and firefighters back in Canada, all those water systems kept running, which means millions of liters of water kept going out. The Pakistan floods, 30,000 patients treated, 11 million liters of water put out. The idea of Global Medic is to take the professional rescuer, have them volunteer so you know they really want to be there, and give their skill set out, and empower local people by training them. So we've basically taken 911 from the Western world and put it into the disaster zone, and I think we're doing a much better job of getting aid to the people immediately and rediverting those funds.
Okay, good. A few things.